Hi class, Professor Diltz, Jessica. I hope you guys are having a great finals week. I'm Martina, and today I'll be playing Dr. Correa.
Hey guys, this is Adam. I'm going to be playing the new hired volunteer at HUP, and today we're going to be sharing a video about the TB skin test, and I hope you enjoy. Oh, finally, the letter came in. I hope I got the position at HUP. Oh my god, I got the position. Thank God. It says I need a TB test. I guess I'll have to phone Dr. Correa to see if I can set up that appointment soon. Hooray!
Adam, how are you? It's so good to see you. What brings you in today?
Oh, it's great to see you too. I'm doing well. I'm actually really excited because I'm starting a new volunteer position at HUP. But apparently they're telling me that I need to get 2 negative TB DPP tests, and I really don't know what that is or why I need it.
Oh wow, congratulations, Adam. What a great way to get involved in your community prior to matriculation into medical school.
Oh, thank you so much.
So excited for you. So what would you like to know about the diagnostic test?
Really everything. I don't really know why they're making me get it. I don't know how the testing works, and apparently I need to get a second test too.
Okay, great. Let's dive right into it.
Awesome. Let's do it.
Okay, Adam, let's start with a brief background. Tuberculosis is an infectious disease caused by a Mycobacterium tuberculosis bacteria that attacks the lungs. It is spread by airborne particles. Did you know that?
I did not, but that sounds really scary.
So if someone that has TB coughs near you, you could potentially be infected. It is important to note that anyone can get tuberculosis. It is not only you. So they're not making you get this test because they're being picky on you. It's just in general, and for preventative reasons. You're going to be exposed to a new cohort of individuals at the hospital who you could possibly infect.
Makes sense.
As a matter of fact, new infections occur in about 1% of the population each year. This makes it the #1 cause of death from an infectious disease. Those at high risk include household or workplace contacts of people with active TB. So, since you'll be at the hospital, you're potentially very, very exposed.
So now that you say that, I actually do remember learning about tuberculosis in one of my infectious disease courses at the University of Pennsylvania's postbac program.
Really? That's so great to hear. Raising awareness.
Yeah.
What else did you learn about tuberculosis?
Well, I learned that the cases are mostly found in regions of Southeast Asia, Africa, and the Western Pacific, but there are a lot of other countries that are susceptible to this disease, and especially for those that are high-risk settings, should definitely get tested.
I agree, and that's probably why they're having you get tested, since now you'll be in the hospital setting. It's funny to note that in the U.S., there are fewer than 200,000 cases per year.
Interesting. That is very interesting. I think I also learned about the 2 different types of TB that exist. One, I believe, is latent TB, which occurs when people are infected and do not present symptoms, nor are they infectious.
Yes, that's latent TB.
And then active TB, which is when symptoms do occur, which include coughing, weight loss, night sweats, and fevers. I heard chest pain can be experienced as well as shortness of breath.
Great job. I'm so happy to hear that people are actually learning about tuberculosis. It's something that should really be taken seriously. Although only 5 to 10% of individuals with latent TB will eventually develop symptoms, it is often treated with antibiotics for prevention reasons. So for 3 to 9 months, they're administered an FDA-approved drug, while for active tuberculosis, they're prescribed drugs for 6 to 9 months. Some of these drugs include isozanib, rifampin, and even butyl. I'm really happy to hear that you're really aware of it. We'll dive more into detail about the diagnostic test. Does that sound good?
Yeah, that sounds great. I think there was also an additional risk factor for TB infection for people with HIV and for people who inject illegal drugs.
That is correct. Let's get into detail with the Mantox test, which began being developed in the early 1900s in Europe. Usually those in the healthcare field are asked to have 2 tests in order to prevent false negatives and to certify that potential future positive tests are caused by a new infection, not a prior one. The TST, tuberculosis skin test, is administered by injecting 0.1 milliliters of tuberculin purified protein derivative, PPD, into the inner surface of the forearm. Upon injection, the tuberculin syringe should be facing upward, as it is an intradermal injection. If administered correctly, the injection should produce a pale elevation of the skin. After 48 to 72 hours, the test is read by the physician or another healthcare provider. The patient is expected to express a small immune response to the bacterial protein within this time frame. The test is read by measuring the diameter of the induration, which is just a small raised area of the skin. If there is no induration, then the test result is negative. If there is measurement anywhere between 5 millimeters to 15 millimeters, it is likely that this individual is positive for TB. However, this depends on the person's risk of TB infection. For example, an induration of 5 millimeters could be considered positive if highly exposed, like the individual lives with people who are HIV positive or have a chest x-ray suggestive of the disease, while an induration of 15 millimeters or more would be considered positive in people with no known risk factors for TB.
Wow, doctor, thank you so much for all that great information. I feel like I learned a lot, and I feel better about this whole test thing. Just a quick question. I have to come back for a second test in about a week. Is that correct?
Yes, that's correct, Adam. So the second test is usually conducted 1 to 3 weeks after you've received your first negative result and read 48 to 72 hours injection, same protocol. Remember, if you don't come back within that time frame, your results are annulled and another test must be conducted.
All right, great. Thank you, doctor. Appreciate that.
Wait, before you leave, I have to ask you one last thing. I'm having trouble accessing your vaccine record for some reason. Do you know if you've been administered the BCG vaccine? It's been found that this is partly preventative for tuberculosis.
I'm really not sure. Maybe when I was a baby, but I can't really tell you.
Okay, I mean, if you have, I want to warn you that you may receive a false positive result from this test, as it is extremely sensible. In that case, you can come back for a second reading to verify that is a true positive result, or simply just have the TB blood test done, which is not affected by prior BCG vaccination. This is the preferred method if you have had the vaccine.
Okay, doctor, thank you so much. So, how much do I have to pay for this?
Okay, we can take a pause there. If you are insured, the test can cost you. If you are not insured, the test can cost you anywhere between $30 and $60. However, I believe most workplaces will cover the cost of your test, and we have your insurance on file, so don't worry about that.
Yes. Thank you so much, doctor. I'm now a TB knowledge guru. I will go around raising awareness about this disease and telling everyone that I know how great of a doctor you are.
Thank you. Take care now, Adam.
Thank you so much.
Bye-bye.
Have a good one.